Syndrome and ponies, and with this I wanted to give you an overview of our current understanding of equine metabolic syndrome, particularly as it relates to ponies, and this has been an area of interest of mine now for 10 years or more. So equine metabolic syndrome then is a clinical syndrome and has three major components. The first is increased adiposity, and that usually manifests as a generalized obesity, so an overweight animal. The second component is insulin resistance, and this is where it is a hormonal problem of the horse, because insulin, of course, is a hormone that's responsible for moving sugar into the tissues. And then the third component is that the animals that suffer from equine metabolic syndrome are predisposed to laminitis, and the common name for laminitis, of course, is founder. This is a significant welfare concern then for horses because of this connection to laminitis. And the real goal of referring to this as a syndrome is to make us recognize that the horse with laminitis may well have a metabolic condition that is predisposing it to this problem. So, as I said before, perhaps the easiest part of this syndrome to recognize is the animal that is obese is at risk for laminitis. And this obesity then may be a situation in which the animal has developed obesity over time, perhaps has been battling this problem for several years, and as that obesity then becomes more chronic, then the risk of problems goes up over time. So it's not just the fact that the animal's obese, but it's whether the animal's been obese for 6 months or obese for 6 years. So in addition to the overall obesity, we also see that horses with this syndrome have problems with fat accumulating in certain regions of the body. So in the photographs that you can see here, you can see that the horse in the upper left corner has a very thick, cresty neck with a large accumulation of fat in that region. The one below is a gelding that shows fat accumulation around the sheath. And the one to the upper right is a picture of the fat that can accumulate above the eye. And then to the lower right, a picture of the fat accumulating close to the tail head. And this is referred to as regional adiposity because it's an accumulation of fat within a certain region of the body that we see in horses with equine metabolic syndrome. So again, you know, here's a photo, and this is a pony that we came upon. My family and I were out for a walk in England and came upon this pony, and this is a Dalesbred pony. And really this animal is just clearly obese, clearly overweight, with a large cresty neck. And this is really the phenotype, this is the appearance of the horse or pony that really is suffering from equine metabolic syndrome, and that we need to look into to a greater degree. We need to recognize that this animal is at risk for laminitis and do the testing that we need to do to be able to establish whether the animal is suffering from insulin resistance and therefore has all of the components of equine metabolic syndrome. So insulin resistance then, just to go back to this is the, again, the hormonal problem that these horses and ponies suffer from, and it really is defined essentially as the decrease in the ability of insulin, the hormone insulin, to stimulate the uptake of glucose by tissues. That's the major abnormality that we see in insulin-resistant animals, but this state of insulin resistance also has consequences in other tissues as well. But if we look at overall the consequences of insulin resistance, the animal with this problem has a harder time moving glucose into tissues, and therefore the glucose concentrations then are trying to go up above normal. The animal is compensating for this by secreting more of this hormone into the blood, and so consequently it has high blood insulin levels, and this is a feature then of this insulin resistance. Perhaps the most worrying part of insulin resistance is that this could potentially alter blood flow, could potentially alter the function of blood vessels within the foot, and therefore make the animal more susceptible to laminitis. That laminitis that these animals suffer from can sometimes be very obvious. The animal, unfortunately, appears crippled, very, very sore in the feet, and that's a more straightforward diagnosis of laminitis. But as we're learning more and more about this syndrome, we're recognizing that horses and ponies can have minor episodes of laminitis where there is damage occurring to the feet, but may not be very obvious to you, the owner of that pony. These episodes can happen where we would actually get some damage to the foot. Perhaps there would be some mild lameness that you might not recognize unless you were riding the pony, or perhaps walking the pony on a harder surface. You might notice some lameness if you were in those circumstances, but the horse standing in the field can potentially go through episodes of laminitis, have damage occurring to the feet, and perhaps not be noticed by you, the owner. We recognize this because we see changes by looking at these hooves and sometimes see what we refer to as founder lines. These founder lines then being the appearance of a line or ring on the hoof that has a narrower distance at the front of the foot compared to at the heel. So there's a wider distance at the heel between that ring and the coronary band compared with at the front of the hoof. And that's referred to as a founder line because those laminitis events have caused there to be a change in the rate of growth of the hoof, with the front of the hoof not growing quite as quickly as the back. And so by seeing these so-called founder lines, we can then get a clue that this animal may have suffered from a problem with mild laminitis that again may have escaped the attention of the owner. If we x-ray the feet, we'll see changes in the position of the bone, and that again goes along with laminitis, goes along with the idea that damage has occurred. So the first recognition really of laminitis in a pony with equine metabolic syndrome may not come until we closely examine the feet and perhaps even x-ray the feet to see if there have been any changes occurring. If we leave these animals and they get progressively worse, eventually then they will have a very obvious laminitis episode, founder episode, where the animal's very painful and hardly able to move. So if we look at the situation with laminitis, then we can come up with this idea that a horse that is out on pasture is potentially exposed to the events that would trigger laminitis. And the horse or pony that's out on pasture then potentially then having a situation where we can have laminitis be triggered by what the animal's eating, by the animal going out and grazing on very lush grass. And if that happens then to all horses, if all horses and ponies are exposed to the same pasture, then some will get laminitis and some will not. And the question then is, why would it be that one pony in the herd would get laminitis and another would not? And as we've developed this idea, we've really come to the idea that there's an idea of a threshold, where an animal then potentially has a lower threshold for laminitis. And we think that insulin is a major factor that determines that threshold. So if we say that the insulin-resistant animal then is more likely to go into laminitis, then that animal has a lower threshold for laminitis so that it will be triggered by going out on pasture, by eating a large amount of grass that potentially contains a lot of sugar and soluble carbohydrate. So going back to the individual animal, and again trying to say, why would that one pony in the herd develop laminitis when there may be 20 horses and ponies out on the same field? And this really comes back then to the individual animal and what individual factors may be involved. One of those is potentially genetic predisposition, and I'll come back to that towards the end of the presentation because I think this is really an exciting area of research as we're trying to look more and more into the question of genetics in these animals. But one thing I think we can all recognize is that the animal that is the so-called easy keeper is then much more likely to become obese. And if we leave that animal in an obese state, we put it at risk for developing the syndrome. So if we take the animal and say this is an easy keeper, then if we recognize that and we feed that animal accordingly and prevent it from becoming obese, we can manage the problem. If we take the wrong approach and overfeed that animal, then the obesity gets worse, and with that obesity then comes the risk of developing equine metabolic syndrome. So why that one animal is more likely to gain weight, why it's the easy keeper or perhaps the very easy keeper, that comes down, I think, to individual, animal, and potentially genetics as to why that animal has that very efficient metabolism, why it's more likely then to become obese. Perhaps also this is an animal that has an increase in appetite, so appetite regulation may be affected. And then finally, it will take us a long time to work this out, but it's also possible that there's some difference in that animal in the way it digests its nutrients or absorbs its nutrients, so that somehow it has an advantage. Somehow it's going to stay at a higher body condition, be more likely to develop obesity, be an easy keeper. And really, when we think about this idea of an easy keeper, we recognize that there's genetic selection for this. The pony that could gain weight and stay fat, when we went into a situation of drought, into a situation of a harsh winter where food supplies went down, that pony was likely to make it through to the next year, whereas the animal that couldn't gain weight quickly when food was plentiful, that animal was less likely to survive. So a certain degree of genetic selection may have occurred to lead us to this situation we're in today, where we have animals that are very easy keepers. Now, when we say that we have an individual animal that's more susceptible, then obviously there's also the way that we keep that animal. And as we keep animals where perhaps we're not riding them as much as we were before, not exercising them as much, and potentially giving them a diet which provides more calories, then these animals that are very easy keepers are more likely then to become obese. So one interesting point that you always have to, I think, remember, and that is that, ponies are not horses. They differ. They have a difference in their genetics and difference then in their selection pressures as well. And we are showing you a picture here of the two animals that we have at home, not the two boys there, the horse and the pony, and we have a quarter horse and a little Shetland pony, as you can see here. And clearly these animals then have different requirements in terms of their diet and their metabolism. So if we look at the management practices for modern day keeping of ponies and horses, then one thing that we recognize is that if we feed grain to an animal that does not require it, if we feed grain to a pony that doesn't require it, and that animal has an efficient metabolism and has the likelihood of becoming obese, then feeding grain to an animal such as that is going to lead it down the path of obesity and then into metabolic syndrome, potentially, and laminitis. We also need to recognize that the pasture is a large source of calories that is largely unregulated if the animal is just allowed free grazing. If the animal is on a large pasture, it has abundant grass, particularly if that grass has been fertilized or the soil is very rich and the grass is growing very well, then we have a tremendous amount of calories that are going into the animal and potentially more calories going in than the animal is using, which results again in the obese state. We also recognize, I think, that if we look at horses, they are actually animals that are affected by season, and one of the effects of season is for the animal to gain some weight in the late summer and autumn, and then lose weight through the winter. Most of us will feed our horses and ponies in the winter because we recognize it's cold, we're worried about the animals, but in doing so, we're actually taking away one of nature's natural corrections to body weight and potentially then leaving that animal in a more obese state when it would normally have lost weight because of the winter, causing it to decrease its body fat mass. As I said before, if we all ideally rode our horses twice a day and we rode them intensely, we would probably keep obesity at bay, but the fact that most of us are unable to maintain that type of schedule, again, reduces the amount of calories burnt through exercise and therefore leads more towards the idea of obesity developing. And then finally, I think, to try to put this as politically correctly as possible, I think in some respects we have to all recognize, too, that we don't need to select animals in the show ring that are at the more obese end of the scale. We need to recognize that a leaner animal is the animal that's in a more ideal body condition, and particularly for ponies, that we need to recognize that that is the way that will keep the animal in a healthier condition, rather than selecting animals that are more towards the obese side, that potentially then, if they remain in an obese state, could then go into equine metabolic syndrome. So again, if we look at obesity, then one of the major factors then is the time that the animal remains obese. And if we look at this diagram here again with the idea that the animal that's out on pasture is again potentially experiencing triggering events for laminitis, and that over time, if the animal stays in an obese state, then we have a situation where we're going to see that obesity then lower the threshold for laminitis and potentially put that animal at greater risk. In the terms of the diet and the actual triggers for laminitis, we recognize that the animal grazing on pasture is consuming sugars and starches in that grass, and that potentially puts the animal at risk because any increase in starch and sugar intake can potentially make the insulin resistance worse. And if that insulin resistance gets worse, and that is a risk for laminitis, then as the animal's grazing on pasture, if we, for instance, think about the difference between pasture in April when the grass is growing well compared with January where there's very little grass, then this represents not only an increase in calories, but also an increase in starch and sugar intake, and that potentially makes the insulin resistance worse. So if we look again with this idea of a schematic, if we take the diet in April and we look at the change in the laminitis threshold, then that laminitis threshold can go down as the animal becomes more insulin resistant. And finally, another factor that we're getting more and more information about is the changes that occur over time within an individual animal. And if we look at, first of all, the idea of a younger animal becoming obese and staying in an obese state, and then we look at the situation where equine metabolic syndrome develops as a result of that chronic obesity, what we're also seeing now is that many of these animals that have battled with equine metabolic syndrome, when they reach their teens, are then developing Cushing's disease. And Cushing's disease is a different type of hormonal disease that we don't have time to go into to a great extent at this point in the presentation. But what we recognize is that when the animal develops Cushing's disease, that further increases the risk. And so if we think about this in terms of timing, then the animal that has been battling equine metabolic syndrome for many years and then starts to develop Cushing's disease when it becomes a teenage horse, then that animal has a further increase in its risk for laminitis as Cushing's disease becomes a part of the problem for that animal. If we look at Cushing's disease, then many of you will be familiar with this common hormonal disease of older horses, but we recognize again that the horse with equine metabolic syndrome is actually predisposed then to Cushing's, and when we get both Cushing's and equine metabolic syndrome occurring in the same teenaged horse, then the risk of laminitis can get even higher. And, you know, when we look at Cushing's, if you look at this photograph of this pony, obviously a very long hair coat, it's clearly got problems with Cushing's, and this would be what we would refer to as advanced Cushing's, and this would be treated with the drug Pergolide. But what we also are recognizing is that if we look at the horse as it's beginning to develop Cushing's, then we may have a pony such as this one that's showing clear signs of equine metabolic syndrome in terms of the crusty neck and the overall obese state. But you can see, I think, that we're getting these longer hairs now developing on the trunk, the lighter hairs because those hairs have been retained for longer and they're bleaching out. And if you look at both of those areas of the body, you can see that there's hair coat abnormalities. And when we see hair coat abnormalities developing in a horse in their teens, then we would say they've got the potential that they're now developing Cushing's as well. So equine metabolic syndrome is in itself going to make the animal more likely to develop laminitis, but when we add Cushing's to this as the animal gets older, then the risk increases further. So we can say then, if we think about how the situation gets worse for an individual horse, then the longer the animal remains obese, the greater the chance is that we're going to get more problems with insulin resistance and laminitis. The more sugars and starches the horse eats, again, this is going to make insulin resistance worse and increase the risk of laminitis. And then finally, if Cushing's is developing, that further increases the risk again. So equine metabolic syndrome is a syndrome that can get worse through diet, through obesity, and then with the insulin resistance side of things, the Cushing's disease can make it much worse too. So having introduced equine metabolic syndrome to you and explained some of the risk factors for this syndrome, I'd like to move now to diagnosis. And one good thing about diagnosing equine metabolic syndrome is that part of the diagnosis is just looking at the animal. So if we recognize the animal's obese, if we recognize the animal has a thick, crusty neck, has regional adiposity, if we recognize that the animal's developing laminitis, the beginnings of laminitis, then these are all good information. It's all going to come together as we make our case for this animal having developed the syndrome. The last piece of the puzzle that we need to look at then is whether in fact the animal has insulin resistance and how bad that insulin resistance has already become. So to do this diagnostic testing, we take really two approaches. The first is a screening test, and if the screening test gives us the result that we're looking for, then that's all that is required. And so this is a very straightforward screening test. Your veterinarian will collect one blood sample, look at the, send it off, and look at the insulin concentration in the blood. We like to perform this testing by just placing the animal on a short-term fast, so taking away the food for just a few hours, about 6 hours. And the way to do this is basically to leave one flake of hay with the horse after 10 p.m. and then that animal will be tested the following morning, and it will have finished its hay by no later than midnight. If you're testing the following morning, then you've fasted for about 6 to 8 hours. You can also do it at other times of the day, but most people will follow that type of plan. When you do the testing, then you're going to look at the insulin concentration, and again recognize that if the animal has insulin resistance, that means the insulin is not working as well as it should be, and the body's reaction to that is to send more insulin into the blood to try to get the same effect at the level of the tissues. In other words, to try to move that glucose into the tissues. So the insulin-resistant horse is going to have high insulin concentrations, trying to compensate then for the problem at the tissue level. So we look at an insulin concentration and have established that if the insulin concentration is greater than 20 microunits per ml after a short fast, that's consistent then with the animal having insulin resistance. We also check the glucose concentration. If the glucose concentration is very high, that would be incredibly important for us to know, because that would potentially signal that the animal has now gone into diabetes, which is rare in horses and ponies, but we obviously have to check the glucose concentration at the same time to make sure that we appreciate this. The more advanced testing then is to go ahead and place an intravenous catheter and then challenge the animal by injecting glucose and insulin into the blood. This sounds more complicated, but is actually the same sort of testing that somebody might have done at a hospital if they're worried about diabetes, and we can do this relatively easily in horses. And the basic principle of this test is that we're going to inject glucose into the blood, and we're going to inject insulin. And by injecting the glucose concentrations are going to go up. By injecting the insulin, the glucose concentrations should go down. In the case of insulin resistance, the glucose concentrations do not go down as quickly and therefore confirm the diagnosis. A third test that we have been developing is a modification in terms of challenging the pony, but is very easy to perform. It does not require an IV catheter. this test also looks at the response to what the animal's actually taking into the intestine and absorbing. And this, of course, is relevant to what the animal's getting in terms of its diet. So if we think about these horses grazing on pasture, then obviously it's how the animal handles the sugars that it's getting in the grass that really we're interested in. So we can't give each animal a test meal of grass to eat, but we can give it a source of concentrated sugars and see how well it does with those sugars. And the test that we developed is a very simple one. It involves essentially giving the horse or pony a measured dose of Karo syrup, corn syrup, because that's a concentrated source of sugars. So the dosage we use is 0.15 mLs per kilo. So for a 500 kilo horse, that would be 75 mLs. We give that orally with a syringe, just giving it into the horse's mouth, just like a dewormer. And the horses generally enjoy this. They like the sugar, so they're going to take it very readily. As long as you don't spill any of the syrup, then you're really going to get it into the horse relatively easily. And then the horse or pony is going to then be dealing with the glucose increasing after receiving this sugar. And it's the way that they handle that increase in glucose that we're really interested in. So the blood sample is collected 60 to 90 minutes later. And here are some results from a study that we did where we looked at the glucose concentrations at 30, 60, 90, and 120 minutes after receiving the Karo syrup. And the horses with green, denoted by IR, those are the insulin-resistant ones. The ones in a more purple color, those are the insulin-sensitive ones. And I think you can see that the insulin-resistant horses, in response to the syrup, they are showing a higher increase in the glucose. But perhaps most interestingly, and the way that we use this then as a diagnostic test, is that we also looked at the insulin concentrations. And if you can see here again, that green line represents the insulin-resistant animals. They're showing a much higher increase in their insulins. Again, this is the idea that the insulin that they're normally producing is not as effective as it normally should be, and so they have to send more of it out into circulation. So they're going to have even higher insulin concentrations in response to the sugar. So we've really taken this and said, well, if we look at these insulin-resistant horses and we drew a line from 60 across, we could confidently say that the animal that has an insulin concentration over 60 is clearly different from the insulin-sensitive animal. So the current cutoff is 60, although 40 to 60 is considered to be a gray area result that would really prompt us to recheck that animal again. So this has really come down to a very straightforward test that you as an owner can be involved in that you can purchase the Karo syrup, you can work out the dosage, and then give the Karo syrup to the horse or pony and schedule the appointment with your veterinarian for he or she to arrive 60 to 90 minutes later. Veterinarian comes, pulls one blood sample, sends it off, and then interprets the results accordingly. Again, with a high insulin response after the sugar, indicating there's a problem with insulin resistance. So, having diagnosed the problem, we've diagnosed it by looking at the animal, recognizing the obese state and getting the history and seeing how long the animal's been in an obese state. We've also looked at the regional adiposity, the cresty neck, the fat pads that we might see, and finally we've looked at the insulin resistance side of things. And by looking at the numbers that we would get back from those different tests, whether it's a resting insulin concentration, an IV glucose tolerance test, or the oral sugar test, we will have an idea of how severe that insulin resistance is. And that's going to be important to us because we then have to make decisions on how we're going to manage the patient. So the first part of this is that we really cannot allow this animal to continue to be on pasture and getting just unregulated access to sugars, unregulated access to calories, and potentially then staying in an obese state. So the first step then is to remove the animal from pasture and place it in a smaller area where it's not going to get as many calories. So what I usually recommend is a small grass paddock. How small? usually around the size of a tennis court, 1 tennis court to 2 tennis courts, depending on how many animals are being turned out together. It's ideal to have the animal go out with a companion. If there is a companion, the animal's more likely to exercise, and that's going to help rather than the horse or pony standing around not exercising and having more problems in terms of its general welfare. So I prefer a small grass paddock. A dry lot is okay too. And the idea at this point is to get the animal away from the pasture in order for us to manage its diet and make sure that we are controlling its calories. The overall approach we're going to take then is that we're going to take our obese pony and try to move it into a more leaner body condition. In most cases, the animal that is obese, if we can control the weight, we can bring it back to a leaner body condition, and as we do that, the insulin resistance will go away. That's what we're hoping for. That's the first line of treatment in this case, is to get the animal to a leaner body condition. We also have to recognize, however, that a subset of horses and ponies, perhaps 10% of them, will get them to a leaner body condition and they'll stay insulin resistant. And those are much more challenging animals to deal with, and we'll come back to those later on. So first of all, if we're dealing with an obese animal, we can recognize that this state of obesity is affecting the animal's health, and really this is where we just need to be more proactive. We need to think about preventative medicine. There are really no advantages in the modern world for a horse or pony to be obese. So we don't want these animals to remain obese, because we recognize that if they do, some of them will become insulin resistant, and if they stay obese and insulin resistant for many years, they're going to get into problems with laminitis, with equine metabolic syndrome. So first of all, we should try and prevent obesity, and I think it's particularly true in ponies that if we stop the animal from becoming obese, that's a lot easier than moving it from an obese state into a leaner state. These can be very challenging patients to get the weight loss. So the weight reduction plan that I like to use is to really focus on providing hay as the major feed source. We would remove grain from the diet, and this would then be a hay plus ration balancer diet. The ration balancer is there to provide the protein, vitamins, and minerals that may not be present in the hay. And the hay is there to provide, first of all, some calories. We obviously need to maintain some calories, to provide also with the animal with something to do in terms of feeding, eating the hay. And obviously, when we're selecting our hay, we prefer to try not to get into hay that's got a higher sugar content, because that's going to potentially make the insulin resistance worse. In terms of how much hay do we feed? Well, we go on a program where we would reduce gradually. So we would initially calculate 1.5% of the current body weight, then move down to 1.5% of ideal body weight, and then finally, if that doesn't work, we have to go to the final step, which is 1% of ideal body weight. And I'll go through those calculations here. So if we take a pony that weighs 600 pounds, and we said that we will start with 1.5% of current body weight, then that would be 9 pounds of hay. We need to weigh the hay and work out how many pounds of hay each flake is. Then let's say each flake of hay is 3 pounds, then that pony would be receiving 3 flakes of hay a day. Not a great deal of hay, but this is appropriate for the caloric needs of most ponies, particularly the pony that's obese and not exercising. With time then, if we're not seeing a response when we place the animal on that type of diet, if the animal's not losing weight, we need to go down to 1.5% of ideal body weight. And if that ideal body weight is 100 pounds lighter, that would be 500 pounds, would be about 7.5 pounds of hay, which is about 2.5 or so of the flakes of hay. If that doesn't work, we're down to 1%, which is less than 2 flakes of hay a day. This is a low amount of feed, and we have to recognize that this is difficult then for some animals to deal with this smaller amount of feed and still maintain their normal welfare. And again, this is where giving them some exercise, a companion, and so on, can offset that to a degree. I just want to present one chart that comes from a paper published in 2008 looking at Shetland ponies, and this was really to try to get a great deal of weight off these obese Shetland ponies, and this is certainly beyond anything that I would recommend. But just to point out that in this study, in order to get the animals to lose body weight, to really get them thinner, they had to take these animals, if we look at this lowest row here, these are the percentages of body weight. So I was just talking about 1.5% body weight, and that's what they started with. But over time, they had to take them down to a really small amount of hay in order to be able to keep losing weight in these animals. And I think this study illustrates just how challenging it can be to get obese Shetland ponies to lose weight over time. And so again, I would not recommend, my recommendation is never to go below 1% of body weight, and so really very quickly in this study they were going below my recommendation, and certainly I would never recommend down to what they got to, which was less than 0.5% of body weight. This is really just to illustrate how challenging it can be in terms of getting obese ponies to lose weight. So the other approach then, if we can only take them down to 1% of body weight and then hold steady, is to get the animal to lose body fat mass through exercise. And again, this is an area that we need more research to try to give us good guidelines for how many calories we can actually cause an animal to burn by exercising it. But I think generally we can look at the idea that the more exercise, the better. And certainly if we can exercise that animal on a regular basis, so we're doing it 4 to 7 days a week, trotting or cantering for 30 minutes or more, then we're really getting into some good exercise to help burn calories and lower that body fat mass. Obviously, if the animal's already laminitic, that is very challenging. And then finally, if we look at the other options in terms of feed, if we have to give something to our horse or pony, and my own pony that I showed you earlier on, we have to give him something every day just because it's a part of his welfare, I think. We really strictly limit him to 1 cup of one of the low-sugar, low-starch feeds. And this is, there are many of them available. Here at the bottom of this slide you can see some examples. But essentially then these have now been formulated and provide us with a nice way of providing some calories, some treat to that animal without increasing the sugars and starches. So for that obese animal, we would be down at the level of a cup of this twice a day just to be able to give supplements or to be able to give a treat. In some cases, in that perhaps less than 10% of cases, where we have a leaner animal that perhaps has got to the point where we're happy with the body condition, but we're still insulin resistant, then these types of low sugar, low starch pelleted feeds are a way of giving calories to those animals without making the insulin resistance worse. So they have become very helpful for those particular types of animals. Most of our cases, though, the other 90%, they're going to be obese animals and they require weight loss. So really these pelleted feeds being used then are really for those treats to try to make sure we can, again, give supplements and provide a little bit of a treat. So if we have been successful with our animal and lost the body weight, then we're at a point now where we will retest, see where we stand at this point. If all has gone well, we've managed to move that animal into a leaner body condition. We may have increased the fitness of the animal through exercise, and hopefully as we retest the animal's insulin sensitivity, we'll now see an animal that's gone back to a normal insulin sensitivity. If that's the case, then we really have to think about sending that animal back out on pasture because it needs to return back to the herd and go back to doing what it was doing before. The problem with this decision to send them back to pasture, though, is, of course, the genetics of that animal are still the same, and if we allow it to go back to exactly what it was doing before, there's a good chance it'll go back to being obese again. So we really have to think about giving it some access to pasture, but limiting the amount of calories. And also, as we do put it back on pasture, rechecking the situation to make sure that the animal's able to cope with those changes in the sugars and starches that it's likely to be eating. So if we look at most of our cases, if we get them to a leaner body condition, we can put them back out on pasture in some way, but again, limiting the total number of calories the horse is eating. There are some, though, perhaps again, there's less than 10% of cases, where these animals really are insulin resistant, and even after we change their diet, change their exercise, they're still insulin resistant. These animals really then, I think, have to be placed in that grass paddock and left there, because really we can't risk sending them out on pasture. And the same again for those horses that have had repeated episodes of laminitis. We've sort of learned our lesson the hard way, sent the animal out on pasture and regretted the decision. Then obviously if they have another episode, then they really have to stay off pasture. It's obvious that animal is not going to be able to cope with the triggering factors that occur on pasture. So our goals then, as we put the animal back on pasture, is to allow it to have that freedom to go back out with the herd, but to prevent it from becoming obese again, and also to be careful of the amount of sugars this animal is going to be exposed to. So the strategies then for controlling the caloric intake would be to limit the amount of time the animal goes out on pasture, and certainly initially you would only turn out for an hour at a time to be able to see how the animal is doing with that and gradually transition back. Grazing muzzles are a good way of allowing horses and ponies out on pasture, but controlling their intake. And then we can use electric fence and other forms of fencing to allow the animal to increase its time and exposure to pasture without letting it have full access to the whole pasture, by limiting to perhaps a corner of the pasture or a strip of the pasture, and then moving the fence every week or every 2 weeks. We also have to recognize that there's a certain degree of strategy to this. So if we see the grass growing rapidly, if we are mowing our grass more frequently in the spring or in the summer after some heavy rains, then those are high-risk times for the horse, and that's a good time to keep that animal at a very low level of access to pasture. If we think about, again, when we get into drought conditions, when the grass is stressed, or in winter conditions at the beginning of winter when we're getting into the first frost, again, these are times when the grass is accumulating sugar and again placing that animal at greater risk. So through our own management, through our own knowledge of what's going on the pasture, we can either increase or decrease the access to pasture, knowing that our patient is at risk for laminitis if we give it free access. So we have to control that access and modify it by season, by rainfall, and so on. Just a quick word on grazing muzzles. Again, I'm a fan of grazing muzzles, use them on my own pony, but recognize too, grazing muzzles are an expense. And one expense associated with grazing muzzles is they wear out. And so as you can see on this slide, the one on the right has clearly worn out and is no longer effective in reducing the amount of grass that the pony is getting. Only when it's intact with only that small hole in the middle is it really doing its job. So just a word of caution, if again, I recommend grazing muzzles, but be careful that they are maintained appropriately. And then lastly, we have to talk just for a minute about medical treatments. Obviously, as a veterinarian, I have some medical treatments that are options in these cases. And the ones that are really the most commonly used are one called Thyroel, which the proper name for that is levothyroxine. The second is metformin, which has a trade name glucose-insulin. And then finally Pergolide. And I mention Pergolide again because this is the drug that is used to treat Cushing's. So just to take each one of those for a second, the Thyroel or the levothyroxine was given to a lot of horses and ponies, 10, 15 years ago with the idea that they suffered from a low thyroid hormone concentration. And although thyroid hormone concentrations vary a great deal in these animals, it's not the cause of their obesity. So this was a drug that was being used, a supplement that was being given to correct a problem that really I don't think at this point is the cause of what we're seeing with obesity and insulin resistance. Now, having said that, this is a drug that, when given at higher doses, will stimulate the metabolism of the animal. And if you know anybody who suffers from high thyroid hormone concentrations or hyperthyroidism, or if you've had a cat suffer from hyperthyroidism, you'll recognize that these people and cats are thin. So high thyroid concentrations will lead to a faster metabolic rate and lead to weight loss. So by placing a horse on this ThyroL, then we can actually speed the weight loss. And so this drug can be used in a short-term basis, so 3 to 6 months at a higher dosage, in order to increase the rate of weight loss. And so this is being used for that purpose and is effective in aiding the weight loss, speeding the weight loss up, and that's something that's desirable if we think about moving our animal from an obese state to a leaner state in a faster time. The second drug, metformin, or glucophage, is a drug that's very commonly used for the treatment of diabetes in humans. It's the most commonly prescribed drug for that problem. This has had some research done to look at it, and interestingly, this drug is not very well absorbed in horses. And so one of the problems we're facing with metformin is not really knowing the appropriate dosage for this drug. So we started out with quite low dosages and now are tending to move to higher dosages, or at least giving the drug more frequently during the day, so 3 times a day. This drug then is one that we will prescribe in situations where we're dealing with that, say, 10% of horses or ponies that are still insulin resistant even after our diet and weight loss program. So these are the ones that perhaps need a little additional medical management because they're not responding as well as the other 90%. So as I say at the top of this slide, these drugs should never be used as substitutes for diet and exercise and management changes. The idea is that we're not going to use drugs instead of doing the hard work of getting the weight off the animals, but in certain cases they are warranted for ThyroL, warranted to speed the weight loss, and for metformin, warranted in the cases of the horses that are insulin resistant even after we've got them to a leaner body condition. And then finally, pergolide. If we have an animal that's beginning with Cushing's disease, if it's a middle-aged animal that's starting to have this problem on top of equine metabolic syndrome, then we can control this problem with the drug pergolide. And so that's the use in situations such as that one. And I promised to return to genetics, and this is where we stand with genetics right now in terms of ponies and horses. It's really one pivotal study that was published in 2006 from the Mayer Center in Virginia, associated with Virginia Tech. This study then looked at crossbred Welsh and Dartmoor ponies in a large herd of 160 animals, and they really looked at what was going on in terms of the metabolic situation with the ponies. They looked at their insulin concentrations and glucose concentrations and triglycerides, but they also then took the information that they had as far as the breeding that had been going on and the families, the genetics, and really said, okay, do we see any increased likelihood that the pony that has laminitis or has suffered from laminitis in the past, is that somehow related to other ponies that have suffered from laminitis in the past? And sure enough, they found that there was an association, that ponies that had suffered from laminitis in the past had a greater likelihood of being related to other ponies that had suffered from laminitis in the past. So some evidence then that there's a genetic link, and this has been something that I've certainly experienced in my clinical practice, where the owner has owned perhaps the mother of the horse I'm looking at, perhaps a horse that they say is related, and sure enough, both the mother and the daughter, or the related horse or pony, is also suffering from equine metabolic syndrome. So I think some evidence then that the genetics may be there to make that horse or pony more likely to become obese, and then everything else following on from there as that obesity develops. So I leave you really with this slide, and that's to say that if we look at the genetic side of things, we've really only touched the surface. And This presentation has been part of a large group project that was funded by the USDA, and part of that group is the University of Minnesota Genetics and Genomics Laboratory. This group at the University of Minnesota are trying very hard to look at the genetics of equine metabolic syndrome in ponies and in horses. And I provide you here with their website, their link, and they are still trying to get horses and ponies that suffer from equine metabolic syndrome to be part of this study that involves collecting some blood, collecting then from the blood some DNA, and being able to look at the genetics of equine metabolic syndrome, with the goal, I think, in the long term of developing a genetic test to be able to say that this animal standing in front of us is really at higher risk of developing laminitis because it has the genes that are likely to make it become obese, likely to make it become insulin resistant, and likely to make it be at higher risk of laminitis. So I thank you for your attention, and again apologize for starting late, and we'll try to answer any questions by looking now at the chat box here. I noticed that my colleague Dr. Tadros has been fielding questions as we go along, and perhaps if she's listening, I can ask her to draw my attention to any in particular that may need further discussion. I think at this point we will be able to handle the questions through the chat box here, and well, thank you again for your attention tonight, and we'll pick it up on the computer here with the typing that we can do on the chat box. Thanks a lot. Bye.
Great, thank you so much. I just want to take a quick minute to say thanks to all of you for attending this presentation by My Horse University and the University of Minnesota. And this presentation was the sixth of 7 webcasts offered in a series to bring horse enthusiasts the most up-to-date information on equine genetics. And the series is funded by the United States Department of Agriculture's National Research Initiative. And I want to take a minute to especially thank Dr. Frank from Tufts University for this presentation, and to Lisa from the University of Tennessee for answering questions tonight. The presentation tonight was recorded and will be uploaded to our website, myhorseuniversity.com, by the end of the week, so you can check there if you would like to review it. And we will have another free webcast next month on November the 29th at 7 p.m. on the topic of winter care and feeding for your horse. So for more information on that and to register online, you can go to myhorseuniversity.com. Thanks again.